times.
As people are coming into the meeting, we welcome you to the July luncheon for the Cy-Fair Houston Chamber of Commerce. So glad that you're here with us today. If you aren't muted and your video is not shut off, if you will do that for us, please. We've been told that that will keep our work going smoothly. So if you will, I'll ask you to turn your video off and mute yourself if you're not already muted, which most of you should be muted. And we'll get started momentarily. Thank you for waiting. I know a couple of y'all were in the waiting room since 11:30. And I'm super excited that y'all are here with us. So we'll get started momentarily. I think everybody is in. A little housekeeping. I think that we've got it set up so nobody can unmute themselves or turn their video on. If your video is on, if I'd ask you to go ahead and turn your video off, please. I have a lot of great information that we're going to be sharing today. And if you have a question, go ahead and type that into the chat feature. Jennifer Ellis will be managing that for us at the end. We may have question or time for maybe 2 to 3 questions tops. But we ask that you sit back and listen to our speakers today. So glad to have our State of the Hospitals for Cy-Fair with us today. Today we have Keith Barber, CEO of Houston Methodist Willowbrook, Jim Brown, CEO of HCA Houston Healthcare North Cypress, Mario Garner, president of CHI St. Luke's Vintage Hospital, and Josh Urban, who is the senior vice president and president of community hospital operations for Memorial Hermann Health System. Wanted to side note, let you know, Keith Barber served on our board of directors for his terms of 6 years and was glad to have him with us. And then Jim Brown also currently serves on our board of directors. So glad to have some healthcare folks in our leadership as the chamber. Our moderator today is going to be Mr. Keith Barber from Houston Methodist. So Keith, I'm going to turn it over to you.
All right, thanks Leslie. And it's great to see everybody today. And I'm certainly honored to be here along with my colleagues, Josh, Mario, and Jim. And I think good for you all to know that not only have we been working within our own systems, but we've been working across systems. Some of our top executives at the main medical center come together every single day across all 4 of our organizations to collaborate about how we lead through these difficult pandemic times. So it's great for all of us to be with you today. So we'll go ahead and just jump into the first question. The first question is, I understand no one knew this pandemic was coming, but can you tell us how your healthcare system's actions and steps taken prior to COVID-19 have helped you during this pandemic? So Josh, can you get us started on that with that question?
Sure. Yeah, happy to jump in and take the first question and invite others to add on necessary. I think one of the things that's been happening in Houston healthcare across all of our organizations is we've all been doing some various forms of expansion over time, right? Because certainly the place we find ourselves in right now, and particularly over the last couple of weeks, has been kind of out of beds. And so the fact that all of our healthcare institutions have been building beds and expanding services has positioned us to be better. Then, of course, we go through surges from time to time during flu season or just other busy seasons. And so we're always kind of stressed from that perspective and have plans that we pull off the shelves from time to time to handle those stressful, surging moments. And, we do drills for things like this. And then we've handled other infectious disease scares, if you will, throughout the years that puts us through the practice ringer as well too. So just a couple areas to highlight, and certainly others can add on to that if they'd like.
All right, Josh. Mario, you want to add to that?
Sure, I can. Thank you for that, Keith. Couple of things. At St. Luke's at the Vintage, and I'm sure other hospitals and other systems, this is actually something that we prepare for when we orient our employees to our facility and bring our physicians on board. We talk about emergency preparedness, including, pandemic preparedness. Now, COVID-19 was certainly, a new one for us, and policies have emerged, through the CDC, and other guidelines have, changed over the course of time. But we have been in communication with our corporate office in real time and made those adjustments as necessary. As Josh mentioned, we have a surge policy that we have enacted to ensure that we have the appropriate settings to take care of patients. We work collaboratively with our system office around assuring we have enough staff to take care of the patients. And then we have the appropriate infection prevention guidelines in place, wherein, we still work toward ensuring that patients are well taken care of, patients are appropriately masked, and that our caregivers are appropriately masked and have on the appropriate personal protective equipment to be able to take care of the patients and not continue to spread the virus. And so, although COVID-19 has emerged over the past couple of months, emergency preparedness, pandemic preparedness is something that we always focus on, but then too, we stay in close contact with, federal agencies and our division and Common Spirit, our companies, support mechanisms to make sure we have the latest and greatest operational practices in place.
All right, thanks, Mario. Jim, you want to add to that?
Happy to do so, Keith. Thanks a bunch. I think, my comments could be echoed by any of my peers, and I think both Josh and Mario have already spoken to this to some degree. We're well accustomed to setting up centralized command structures in the event of natural disaster or otherwise. And I think for each of us for the past 4 months, to some degree on a daily basis, we've all had our central command structures functional. Additionally, what many in our area may not recognize, we're blessed to be served by 4 substantial health systems that are either regional or national in nature. And as such, the strength of our supply chains, I think, benefits us greatly in a situation like this. And thus far, to my knowledge, we've not seen some of the challenges that may have been fought in rural areas or by health systems without the scale. And then final thing I would add is throughout this, we have gone through periods of time where we work as an A team and a B team in order to give people appropriate respite and quite honestly, to avoid exposure of some of our staff at any given time. And that's much akin to how we would work in a natural disaster like a hurricane, albeit this is a much longer duration. But I think not only the education and drills that we do, but just our past experience have helped us to prepare for this.
Yeah. Thanks, Jim. The things I would add to that, certainly crisis management, but we get great practice when we have a Harvey or a Texas Day storm from a crisis management perspective. But we always know that those are about 5 days long, and then we get to tail off. But this is absolutely about running a marathon with crisis management. So that's certainly been the new thing for us. And so certainly we lean on those experiences from the past, but we're having to make adjustments because I think, we've been at full-blown crisis management when this thing first started. But then I think the question was, how do you tail that off and do it more for the long run? So I think we've all had some good practice at that. And I also think for healthcare and what I know about only our own organization, but others as well, I think for as large of an organizations as we are, we're actually pretty flat and we're able to be nimble and really turn on a dime. And that's really, really important. I think pulling from what we call a daily rapid process improvement cycle, where we really have a team that has walked the ER every day and say, okay, based on what's going on today, what problems we had, what do we solve that to make things better tomorrow? And then I think also just recruiting the great minds that we recruit within our organizations. Dr. Ashley Drews is our head of infectious disease for Houston Methodist, and it's been great to literally be able to pick up the phone and call her at times on protocols and problem solutions. So those are definitely some added things that I think have been in place that have really helped take us through these really difficult times. Okay, so we'll move on to the second question, and Jim, I'm gonna ask you to take this first. So I imagine that COVID-19 is your focus, but what else are your healthcare leaders thinking about right now?
Yeah, I think this is one of the key challenges for us in this crisis as executives is consistently reminding our teams that there's other business at hand. And as you talked about the marathon, and I referenced a 4+ month duration now, we still, to some degree, are running elective schedules. We're continuing to see outpatients. We have inpatients not necessarily impacted by COVID. And I think, unlike past disasters that we've managed for short durations, this one presents a very unique challenge in that we are having to live in a bifurcated world and manage safely for our COVID positive patients and our staff on the front lines treating those patients. But then again, for each of our own solvency and to protect jobs, it's important that we be able to operate our conventional businesses at the same time.
All right. Thank you, Jim. I'll take the second on that question. One of the things that I have thought about through this entire crisis is, quite frankly, as leaders, being able to multitask and not only focus on COVID, but focus on other things. And then sure enough, just recently, Mark Boom, our president of our system, he calls it the sacred and. And so I actually listened to a WebEx he did the other day where, one, we have to control COVID. We've got to listen to the scientists, wear our masks, and do what we know that we need to do. But we also need to protect our economy. So I think that's not only on, I think that's on everybody's minds, but that's certainly on us as healthcare leaders' minds. So how can we protect our economy so that as we're coming out of this, we're not coming out of a deeper hole, but one that that is helping to be part of sustaining each other. And the other thing that I think is really on all of our minds is educating our children. We got school getting ready to start, and I think that that's a really tough thing. So really doing all of those things and simultaneously, I think we become a little polarized. And I think for all of us to come together and work together on simultaneously doing all of those things, I think actually we could be more successful than we have been. The other thing that I would add to that, which has been a concern, is, as we've focused on COVID, when we kind of shut our procedures down in April and then started opening up in May and June, we saw serious issues for people that had even delayed care in that month. So the other thing we think about is, as we're going through this again, simultaneously taking care of COVID, but also taking care of other diseases so that people don't create larger acute situations that then are harder for them to recover from later on. So Mario?
Sure, thank you, Keith. Here at the Vintage, we've really been focusing on keeping our patients safe. A variety of things. We have a designated entrance now, for all of our patients, as well as our colleagues and physicians, and that is to mitigate, multiple entrances and persons who may, come into the facility without being appropriately screened, for temperature and symptoms. We are socially distancing. Zoom has become very popular for us now. We now meet on a virtual platform wherein we used to come together very frequently, multiple times a day and meet en masse. But to protect our leaders and also our colleagues here, we've adopted, the Zoom platform for our meetings and conference calls. Therefore, we can keep our colleagues and staff members safe. And then clearly following the latest, infection prevention guidelines, making sure we're thoroughly cleaning not only our clinical areas, but our public areas, so that we can make sure we mitigate, any potential spread, the virus even in the public areas. And ultimately, even amidst all of these things and, what Keith touched on and Jim, operating in what is now our new norm, that is both, COVID and managing our traditional, care for patients that, came to the hospital previously and continue to do so, is keeping our mission at heart. Amidst the changes that have happened, over the past couple of months, there can be highly stressful times, intense times, but for us, we say that our mission is to make the healing presence of God known, by taking care of the patients that we serve. And so for me, it's important that each and every colleague continues to honor that mission for the patients that we're taking care of. Following all of the, evidence-based practices for, maintaining infection control guidelines, making sure we're protecting our patients, keeping patients safe, keeping our caregivers safe, but then also keeping our mission, first and foremost in the care that we provide.
All right, thank you, Mario. And Josh, you want to wrap that question up?
Sure, and fairly similar thoughts here, but maybe just a couple additional comments. So one would be a focus on people, right? It's hard to focus on non-COVID things these days, but all of us are tremendously focused on our people and our staff, and even the support mechanisms for our staff, their families and friends at home, because it's been said a couple times already, this is a marathon and not a sprint, and people are getting worn out and tired and don't necessarily see the light at the end of the tunnel. And so we've also been asking our staff to stretch beyond what they usually do, probably in many places across all of our organizations, and that creates stress for our clinicians as well too. So just the general health and well-being of the workforce, we've tried to specifically create meetings and committees that are focused on our people side of the business. Recovery has been mentioned a couple times already. So, we're living in a world where we're treating COVID patients and non-COVID patients, and someday, hopefully soon, we'll have very few COVID patients. And so the recovery of getting back to normal is a focus of ours. And then lastly, just the overall impact that this has on the social determinants of health. The mission of Memorial Hermann is to create healthier communities now and for generations to come. And I think this whole COVID pandemic is going to affect, or it is affecting, education and the way schooling systems delivered. So having an effect on the employment and people's ability to earn a wage, the availability of social services and the need for social services, and schooling, which I've already mentioned. So I think that'll have again, long-term effect on the community that will be important for all of us to continue to focus on outside of just providing acute care services, but focusing on community health as well.
All right, thank you, Josh. Okay, Mario, simple question. Is it safe to come to the hospital? Once you started off on that.
Absolutely. We talked about that a little bit in the previous question that was asked. Yes, we are following the latest in CDC guidelines as it relates to protecting our patients as well as our caregivers. We now have a designated entrance at the facility so that we can make sure that we appropriately screen every patient who comes into the facility and get them to the right place at the right time in the quickest manner. We do have certain personal protective equipment requirements for our caregivers, meaning our nurses, techs, housekeepers, food nutrition service workers, even the administrators in the hospitals. We now have PPE guidelines that we do follow. We are being conscientious around procedures that are done in the facilities to ensure that we are able to maintain our capacity to take care of COVID patients. And we are encouraging patients who have familial needs to work closely with our nursing team and others to communicate with family members utilizing technology so that we don't lose that connection between patient and family members, but honor the safety of the caregivers, the patient, and the family members who have a need to be in communication with their loved ones. So hospitals are very safe, and that is what we are here to do. Our patients are in good hands. Our caregivers are in good hands. We have a proven track record of a lot of success with maintaining healthy caregivers even amidst the pandemic. And so, yes, hospitals are safe.
All right, thank you, Mario. Josh.
Sure, I think Mario did a great job of outlining all the tools and techniques that we're probably all following. I would maybe just add a comment that people shouldn't be afraid to come to the hospitals or put off any of their healthcare needs. You've seen probably some data that's been put out by Houston Fire Department and others about the reduction of 911 calls and other people seeking emergency medical treatment and what that's doing from some of the scenes or calls that they are arriving to. It's kind of scary that people are waiting and ignoring signs and symptoms of what could be serious health effects. And so I would just encourage people to not be afraid and do seek out care where needed, because we're all here and safe, as Mario just outlined.
Right. And what I would add to certainly agree with all that, and I think we're all very similarly focused on making sure that our hospitals are safe, so that the consumer and you, the public, can feel comfortable and secure walking into our hospitals. One of the things that we've really focused on is realizing that first and foremost, our employees and our staff have to feel safe and have to feel secure, and that's the ultimate test for even making sure that a patient would feel comfortable coming in. So we've done very standard testing and surveillance testing of all of our employees. And that's been one of the things that has given us confidence. It certainly affirms that wearing masks really works, because we've even, as we test our own employees in the front lines of our ICUs and our ER, we've been having incredible results. And if we do have someone positive, we are looking at tracers on that, and certainly for the most part pointing to more community acquired infection. And so it's given us great confidence in our PPE that we provide our employees, and it's helped our employees feel comfortable as well. The other thing that we've done at Willowbrook is early on, our ER leaders recognized that we just needed more space in order to keep everybody safe. So we set up a large tent outside so that we're bifurcating all patients that come in. And that's really to keep those that are showing signs and symptoms of having COVID related. And we're assessing those. Many times those patients are being discharged from the tent and actually never even coming into the hospital if they can be cared for in an outpatient setting. And then also keeping our COVID patients absolutely cohorted within the hospital to keep those separate from normal operations. So we've been very committed to those principles, and I think that has worked greatly towards keeping us safe. I think we've all re-engineered our hospitals, so waiting rooms look different now, and concierge is being used so that we're actually escorting patients throughout, and then obviously practicing incredible social distancing ourselves, not having meetings. Most of our meetings are virtual, or very few people with masks on and so forth. So I would agree with Mario. The answer is yes, and we're working very, very hard to make it that way. So Jim.
I too would say yes, guys, and I think the precautions that each of us are taking are very similar. A couple of things for the group that haven't been mentioned as of yet would be that anybody coming in for a procedure is receiving COVID testing as part of their pre-anesthesia workup. And as such, that would prevent us from unknowingly operating or performing a procedure on someone who is COVID positive. One of the more difficult things that I think all of us have imposed, because it does impact our patients' healing as well as their experience, is limitations on visitation. In our case, with the exception of parents of pediatric patients or end-of-life issues, at present we are limiting visitation to our inpatients in the hospital. There have been periods of time where there was less community spread, where we were able to relax that to a 1+ visitation policy, and hopefully soon we'll have the opportunity to do that. The other thing that's been a recent learning for us is how to safely operate on the COVID positive patient who presents emergently for surgery. And I think in all of our cases, there wasn't necessarily a playbook on this, and we're incorporating learnings from peers, learnings from our system, learnings from others around the country as this goes. But that, quite honestly, was a success for us, a very healthy test for our surgeons, anesthesia, and team. But that too, I think, gives the assurance that we're limiting visitation, we're cohorting, we're not operating unnecessarily on COVID positive patients. And in the event that we do, we have mechanisms in place to keep our staff safe and our operating rooms and recovery areas sterile.
All right, thank you, Jim. Next question is, what have you learned from other cities or since the beginning of the pandemic that is helping you? I'll start off on that one. And I'm gonna really just put out there with the unity phrase. I think we have learned, if we go back to the start of COVID, if we go to mid-March, in fact, I remember it was the day the rodeo was shut down that really started all this for us. And then obviously we shut down our elective procedures in April, which I think was, we kind of saw the aftermath that came from that. But if there was one thing that we were all about in that early phase, was a very unified plan. And then what we saw is kind of ramping things up in May, and then in June after Memorial Day, I think a lot of people started going different directions, and then I think that we've really paid for that as a community, and certainly as healthcare providers. So I think we've learned how important it is for us to be unified, and I think our communities can certainly take comfort in that our healthcare systems, I think, in many ways have been unified. And then certainly communication and teamwork is always paramount, and we've learned that in many ways. But I'm gonna really stick to, I think, the biggest thing that we've learned is how important it is for having a unified plan. And I think we look for us to continue to strive for that as we go forward, because we certainly see that there's opportunity just as a metropolitan area for us to be more unified in how we handle this pandemic. Jim.
Yeah, well, first of all, I think we're all blessed to be a part of larger health systems. And this is not a time in which I'd want to work for someone who was independent. So certainly there are great learnings locally, in our case, across 13 hospitals, but also nationally across 190. Probably the biggest learning we had early on was just the value of cohorting patients. And I think that's done a lot for our response to this. One, preventing spread within our hospital, but then two, in protecting our team. The other thought that I have, and this really goes to the small fraternity that we are, and as peers across systems, knowing and respecting each other, one of the things that I saw early on was positive pressure in the market for us each to take care of our own employees. And given the duration of this, I don't think there is any employee out there with a vacation or a sick bank lengthy enough to weather this type of a crisis. But when we were early into this, there was a point in time where I think I had 500 of my team furloughed, and was very blessed to work for a health system that was providing our staff during that time period 70% of their regular pay to stay home without penalizing their paid time off bank. And I know each of the systems represented here did very similar things to essentially make sure that our families, while not here, were provided for. And as a result, when here, they could focus and not be overly strained by economic hardship. So that is one of those situations where I think there was a positive force in the market for us all to really step up and provide for our teams.
All right, thank you, Jim. Josh.
Yeah, sure. So a couple things just maybe to add. So one, I think we've learned that the safety measures work: social distancing, hand washing, and avoiding large gatherings, right? We can reference back to the shutdown we had in April, and realize that's not a very popular thing, not suggesting another shutdown, but if we could all do our part to follow those rules, I really do think that is what can bend the curve downward, because we've seen it work a few months ago. Secondly, I think we've learned a lot about collaboration. I think someone mentioned, or it may have been Jim, that each one of our healthcare systems on a normal day are pretty ruthless competitors, but the collaboration we've seen from working together, having all of our senior leaders on a call every day collaborating, has been great, because it sends a very unified and similar message out to the community, which is just awesome, so we don't contribute to any of the confusion or misinformation that gets shared out there. Then lastly, I don't think we've mentioned kind of new treatments and therapies. You've seen the drug regimens and other things that have changed over time. So we're learning that here both locally, and our clinicians are following what's happened in other states as far as treatments and protocols to follow to combat the disease.
All right. Thank you, Josh. Mario?
Yes, to add on to that, Keith, you know, as Jim mentioned, being part of a larger system, not only here throughout metropolitan Houston, but across, you know, over 22 states, and being part of Common Spirit Health, we have had a tremendous opportunity to leverage advancements in other areas, other parts of the country, to bring right here to Houston. And then certainly we know Houston leads in healthcare, so I think many of the hospitals in other states have leveraged the work we've done right here in the city of Houston to bring to their cities and states. You know, very similar to what Josh mentioned, the advancement of the care that we're providing in our hospitals looks a lot different today than it did 2 to 3 months ago. You know, as COVID-19 has emerged, I think of remdesivir, which is, you know, a drug regimen that's being utilized in our ICUs to take care of the patients with good outcomes. The use of convalescent plasma, you know, for patients that suffer from the virus. And then also, you know, placement of patients on ECMO, particularly those patients who are most critical. I want to say the first patient who was basically treated on ECMO was done at a St. Luke's hospital here in the North Market at the Woodlands, and had a very successful outcome. And so the advancements of technology, the advancements of you know, medications and other therapies are taking place right here in the city of Houston, and you know, we are pioneering those efforts, which I think other cities and states are learning from us. And then, you know, ultimately the support of the community has just been tremendous. We've had sign gypsies show up to the campus with Heroes Work Here, you know, signs from various churches. And while the community support almost on a weekly basis has just been tremendous, and it speaks to the heart of Houston and the communities that we're serving right here. So I would like to share appreciation to not only Cypress, the Northwest, but you know, Houston in general, for all the support that you've given here at the Vintage, and I'm sure my colleagues can share the same for your facilities as well.
Absolutely.
Absolutely. The community outpouring has been tremendous for all of us. All right, so fifth question, how is the hospital managing the increased caseload? So Josh, you want to start us with that?
Yeah, sure. So we continue to, you know, just manage it through our incident command structure. And we've, of course, had surge plans in place that we've mentioned already a couple of times on this call that all of us probably continue to tweak and refine every day or week, and staying closely connected with all of our sister hospitals within our systems. And, you know, one of the things, real things we're doing, particularly over the last couple of weeks, is just expanding beds into sort of non-traditional parts of the hospital where we care for inpatients. You know, many of us have turned what used to be our recovery rooms, or even some of our ORs and endoscopy areas, into treatment areas for some of the more critical care patients as the volume has surged above the normal levels. But to me, it's just continuing to learn and change the plans, pursue staff from even outside the Houston area, right? All of our staffing has been stretched, I'm sure. And so partnering with local and national organizations to provide contract labor or nurses through the government to come in and help, and even some clinicians and physicians as well. As that let's go through major surge times, we've just had to bring in extra resources in the community to care for these patients. I'll stop there and let kind of others add on to that.
All right, thanks, Josh. Jim, you want to add to that?
Yeah, happy to do so. We've been very blessed not to have to use those alternate areas of care today, but are prepped to do so if necessary. One of the things that we're beginning to see, and I'm sure my peers are as well, is staff absenteeism as a result of the community spread. And it's taken 3 to 4 months for that really to emerge, but not uncommon to have, you know, 1 to 2 nurses on any given unit be a no-show for the day as a result of his illness. So as a result, while early in this, we eliminated all outside contract labor in order to protect and preserve the jobs of our home team. At this point, we are calling on more and more national contractors to come in and assist to help us manage for those absences caused by community spread. And then the other thing that we're seeing is, being a national health system, that we're able to import nurses from areas less affected by COVID, which is positive. What I would say has really made this manageable is that testing has improved. And when we combated this at a high level in late March, early April, part of what made it so difficult is testing was still relatively poor. And so many people were persons of interest based on their symptoms, yet we might have a positive test ratio of 10%. Now what we're seeing is it's much more clear-cut, much quicker testing. And as a result, our care isn't complicated by treating those suspicious patients. We can quickly get them into the right venue to be cared for. So that has also been a huge positive.
All right, thank you, Jim. Mario.
Sure. To manage the increased caseload, our hospital has the surge plan in place that we've talked about throughout the course of the call, wherein we have safe rooms and safe wards where we're able to cohort patients with COVID-19, make sure that the air circulation is appropriate so that the air is not recirculated, and we keep the patients and the staff members in safe zones here throughout the hospital. And that is something that we round on daily and inspect to make sure that we're maintaining the safest levels of environmental surroundings for our patients and our caregivers. And then finally, we'd work, in a coordinated effort with St. Luke's Health System, the hospitals that we have throughout Greater Houston. If one hospital was ever at a surge capacity or have needs to transfer patients, among our hospitals, we have the bandwidth to do that, not only here throughout the city, but also in our outlying areas where there are St. Luke's hospitals as well. So there is a plan in place to, when there is a need, be able to safely get patients to the right level of care within our system.
Thank you, Mario. Some things I would add to that from that we're doing here at Houston Methodist here at Willowbrook, in addition to our traditional ICUs, because certainly COVID has caused us to need to expand our ICU level of care. So actually, several of our med-surg units were actually able to, we call them universal units, in that as we staff them different, they can actually flex up to become expanded ICU beds. And then in addition to that, the fact that we have really already had in place 24/7 physician intensivists and mid-levels on those units was enabled us to really expand those units, and certainly it's still stretched our staff, but we've at times almost doubled our ICU capacity during this time, which has been critical. The other thing that's been great is really going across our organization and taking RNs that were in administrative duties or had not been at the bedside anymore and retraining them to come back to the bedside. And that's been tremendous for us. And then certainly, again, agency, similar to what you heard, tapping into our national relationships to bringing agency to the hospital. I would say definitely cohorting our units and in dedicated units, again, has been really helped us manage the caseload. And then just daily team meetings that we have. We actually have a team meeting every day to kind of blitz the entire hospital and look at the resources that are needed based on the change. Because COVID, one thing that it's shown us for sure is you don't know what tomorrow is going to bring. So you've got to be able to plan for that day to day. So that concludes our 5 questions. So Leslie and Jennifer, do we have time to take some additional questions?
Yes, I think we have time for like maybe one question. Thanks so much for speaking to us today. We appreciate it. You had a lot of great information. It looks like one of the questions we had was, other than social responsibility precautions like wearing masks and social distancing, what other actions can we in the community take during these times to support both the community health and our caregivers who are stretched?
All right, Jim, you want to get started with that?
Yeah, on the human side, I would say for those people working on the front lines, just continue to offer them your prayers and your encouragement. And if you have family or neighbors working on the front lines and there's anything that you can do to ease their burden outside of work, whether that's help run a child to school or an extracurricular activity or make a grocery run, try to do so.
All right. Thank you, Jim. Mario, you want to add to that?
Yes, sir. A couple of things. I think stay home if you can. Certainly want to stay home and stay safe to help prevent the spread. I think if you're in public, wear masks. I think mask is one of the biggest acts of kindness we can show to our neighbors in our communities during this time, to also help prevent the spread. So stay home, stay safe if you can. Wear mask in public. I'd say avoid large gatherings, obviously to prevent the spread of this communicable virus, and then ultimately wash your hands, keep yourself safe. So those would be my big 4 pointers. Stay home, stay safe if you can, wear masks, avoid large gatherings, and wash your hands.
All right, thank you, Mario. Josh.
More to add. I think that both of those guys just summed it up perfectly.
I think if I were to add anything to that, I think what we've seen, again, this relates to the fact that we are running a marathon, and what we're seeing now is just more signs of stress and anxiety, realizing that we're going to be doing this the balance of the year. So quite frankly, over the last several months, we've kind of figured out how to do this, and I actually couldn't be more proud of our teams as we have done this. We've been able to keep the hospital safe and to continue other services. But I think our new challenge is sustaining each other and dealing with anxiety, whether it's your loved ones or your healthcare workers. And so one of the things we've done is we formed a morale committee to keep it fresh. And so to do everything we can every day and bring variety into that. So as Mario said earlier, I have to absolutely echo, the community has been tremendously responsive. There's hardly a day that goes by that somebody's not bringing Chick-fil-A to our staff or are doing some form of recognition. And so I would say keep that up. It does actually sustain and encourage our teams, and it's so appreciated. So, and Leslie, if I could just, as we wrap up, I'd like to come back to just that theme of being unified. Again, to be here with Josh and Mario and Jim is an honor, and I think we all, I think I can safely speak for all of us, because I know Josh mentioned it as well. We've been proud to be unified as healthcare systems coming together to manage this global epidemic for Greater Houston together. And I think that that's something that we want to instill in our communities, is that we all need to come together. And so as Mario said, absolutely wear your mask. It's the simplest thing you can do to not only take care of yourself, but take care of your healthcare workers. And as Josh said, let's keep that curve flattened. So thank you so much.
Thank you, guys. I want to thank our panelists for being with us today. I know we learned a lot and heard a lot. We hear a lot in the news, but I thought it was just really important for us to hear from our frontline CEOs of our hospitals in Cypher. So I really appreciate Josh and Mario and Jim and Keith. And Keith, a special thank you for moderating. I appreciate that. We will have a time at 1 o'clock if you want to do some networking. I know that's a lot of things that people are missing, is the networking. So there'll be a separate Zoom meeting at 1 o'clock if you want to join us there. Our panelists, as you can imagine, are very busy. They will not be on that networking call. So they have plenty of other things that they need to be working on to keep us safe and keep us healthy. So again, thank you very much. Thank you all for joining. If your question wasn't answered, we will bring it up in the chat room, and I definitely know how to get a hold of these 4 gentlemen. If I can get the questions to them, I'm sure they'd be happy to answer it. So thank you all for joining us. And again, thanks to our panelists, and y'all have a safe and wonderful day. Thank you.
Thank you. Thank you very much.
Thank you.